emerging trends. A very good morning to one and all. At the outset, it gives me immense pleasure to welcome one and all on behalf of KJ Mehta TB Hospital Trust and College of Dental Science and Hospital Lamargad to this national webinar on AI integration in dentistry and career opportunities. A warm hi to all my friends who have joined from down Karnataka, Bengaluru as well. And as you all know, artificial intelligence is rapidly transforming healthcare, and dentistry is no exception, enhancing diagnostics, treatment planning, and patient care. We are witnessing a significant shift where technology and dentistry are converging, and at the same time, it is opening new and exciting career pathways beyond conventional clinical practice. Hence, we can say that AI is shaping the future of dentistry and expanding uh, our career horizons, and also redefining how dental professionals can build diverse and innovative careers. So, this session will provide valuable insights into these emerging trends. So, as educators and professionals, it is essential for us to understand and adapt to these advancements to prepare our students for the future. So, today's session will help us explore these evolving opportunities and understand how to stay relevant in this dynamic era. And so, I warmly welcome our distinguished speakers for today, Dr. Ritu, Nandal, and Dr. Akshata, Poojary, and invite them to begin the session. And the first speaker for today would be Dr. Ritu. Am I right, Dr. Akshata? Shall
Yes,
I
yes.
introduce her, or would you take up? Would you take up?
Hey, you can introduce her.
Okay, fine. So, okay. Yeah. So we shall start with the introduction of Dr. Ritu Nandal, who's the first speaker for today. Dr. Ritu Nandal is a dentist working at the intersection of clinical dentistry, artificial intelligence, and digital health innovation. And she completed her Bachelor of Dental Surgery from DAPM, RV Dental College, Bengaluru, and Rajiv Gandhi University of Health Sciences. And currently, she contributes to the growth of ScanO, an AI-powered platform that is working to transform preventive oral healthcare and digital dentistry. Her work focuses on building strong clinical and academic ecosystems around AI-driven dental diagnostics. She actively collaborates with key opinion leaders, dental institutions, and research partners to support the adoption of AI technologies and generate clinical evidence and advance innovations in dental technology and healthcare AI. With a combination of clinical insight, communication, and strategic collaboration, she works on enabling large scale oral health screening initiatives, research collaborations, case study developments, and meaningful partnerships that bridge dentistry, technology, and real world clinical impact. She's particularly passionate about improving accessibility to oral health care through AI research and data driven dentistry, and she look forward to discussing how emerging technologies like AI can shape the future of dentistry. So over to you, Dr. Ritu.
Thank you, Doctor. Thank you for such a warm and wonderful introduction. And it's a pleasure to be here today to speak about a topic I am deeply passionate about, like you rightly mentioned, Doctor, how artificial intelligence is transforming dentistry. So before we begin, I'd like to thank the organizers for their willingness to accept our webinar proposal and for organizing this platform to enable such a valuable dialogue. It's an exciting time for dentistry. I think we are seeing technology move beyond diagnosis and begin to reshape preventive care and patient engagement. Today, I'll share how AI has evolved from a futuristic concept into a practical chairside companion, supporting the way we screen, diagnose, and manage overall oral health. Let me just quickly pull up my presentation and we'll get started. Hope my screen is visible. Dr. Akshata, can you confirm?
Yes, yes. It's visible.
Yes. So I think AI has become a buzzword in almost every industry today. And like Dr. mentioned earlier, dentistry is no exception to that. We hear terms like AI powered, smart diagnostics, automation everywhere. But the real question is how much of this is actually being used meaningfully in daily dental practice? For a long time, AI in dentistry sounded very, very futuristic, something interesting to talk about, but not necessarily something practical or reliable. Today, now that has started to change. We are now moving from AI as a concept to AI with real clinical applications, tools that support dentists in diagnosis, improve consistency, save time, and enhance patient communication. So in this session, I'd like to focus less on the hype and more on where AI is genuinely adding value, how it fits into clinical workflows, and what real use actually looks like in dentistry today. So I think let us start by understanding why dentistry needed AI in the first place. So to understand why AI matters in dentistry, we first need to understand the scale of the problem here. So today, 3.7 billion people worldwide are affected by oral diseases, yet only 30%, 34% of these cases are actually treated. That means a vast majority of patients either remain undiagnosed or enter the system far too late. At the same time, dental clinics globally operate at roughly around 65 to 70% of unused capacity. Chairs, equipment, and clinicians are available, but patients are not reaching care early enough. Now, this highlights a fundamental issue. Dentistry is still largely reactive rather than preventive. Patients typically visit only pain when only pain appears rather than for early detection and risk assessment. Now, this gap between disease burden and underutilized clinical capacity and late diagnosis represents a very real opportunity here. An opportunity to shift dentistry towards early identification, better screening, and I think proactive care. And this is precisely where technology, especially AI, can play a very meaningful role. I think in the next sections, I'll show how AI helps bridge this gap in a practical, more clinic friendly way. Now, when AI first entered the conversation in dentistry, it came with two major myths. Myth one is that AI will replace dentists. Now, that fear created resistance, and understandably so. Dentistry is highly clinical and a judgment driven profession, and no technology can replace clinical expertise. Now, myth number two was that AI can solve everything. Now, this expectation was equally problematic. AI was often portrayed as a magic solution without clearly defining its limits or responsibilities. Because of these two extremes, fear on one side and overpromising on the other, AI adoption in dentistry was slowed by confusion, skepticism, and uncertainty. What's changed now is clarity. Now, today we understand that AI is not a replacement. It is not a silver bullet. It is a clinical support tool, one that assists dentists by improving consistency, highlighting potential findings, and supporting decision making. Now, with these clearer use cases, better validation, and real world deployment, AI is finally moving from theory into a meaningful everyday clinical use. Now, let's look at what these real use cases actually look like. When we talk about real world AI in dentistry, its role can be understood very simply. AI helps dentists in four key areas. Now, number one is diagnosis. Now, AI assists in identifying patterns and highlighting potential findings in images, supporting clinicians with consistency and speed. while always keeping the dentist in control of the final decision. The second number is communication. So AI provides clear visual cues and structured outputs that make it easier for our dentist to explain findings to patients. Now, when patients can see what the clinician is explaining, understanding and trust improve significantly. Third is education. AI helps educate patients about their oral health by translating complex clinical information into very simple, more understandable insights. This empowers patients to participate actively in their care. And finally, engagement. Better understanding leads to better engagement. Patients who clearly see and understand their condition are more likely to accept treatment and follow through with care plans. So, when used correctly, AI becomes both a clinical assistant and a communication assistant, supporting better dentistry, not replacing it. I think despite advanced clinical skills and good technology, many dental practices still face the same operational challenges. Data is often scattered across systems, images in one place, notes in another, and reports somewhere else. This makes it difficult to build a clear, continuous patient story. As a result, clinics experience low recall rates and reduced lifetime value of patients. Many patients don't return, not because care wasn't good, but because the value of follow up wasn't clearly communicated. There is also poor patient understanding. When patients don't fully grasp their diagnosis or risk, it leads to low case acceptance and hesitation around treatment decisions. Now, add to this inconsistent follow ups, and suddenly patient flow becomes very unpredictable, busy on some days and empty on others. So that I think the key insight here is the core problem is not just clinical, it's definitely communication. When patients understand better, they trust more. It is very simple. When they trust more, they accept care. And when communication improves, both clinical outcomes and practice performance improve. This is where AI enabled communication begins to make a real difference. Let's move from concepts to real life usage here and see how AI fits naturally into the patient journey without disrupting clinic workflows. So now it starts at the reception. Within just 2 minutes, AI-enabled screening can capture baseline information and flag potential risks early. This kind of sets the context even before the patient meets the clinician. Now, next comes the consultation part. Here, AI supports the dentist with risk indicators and clear visual outputs. Instead of those lengthy explanations, dentists can show patients what's happening, making the decisions faster, clearer, and more effective. Then comes the post-treatment part. Here, AI helps deliver personalized guidance, what to monitor, what habits to improve, when to return for a follow-up. This improves recall and keeps patients engaged even after they leave the clinic or the hospital. I think what's very important to note is that AI isn't a separate step. It's actually embedded across the journey from entry to consultation to follow-up, supporting both clinical decisions and patient communication. This is how AI moves from being a tool to becoming part of everyday dentistry. Now let's look at what this means in terms of outcomes. Let me just briefly explain how Scano's AI models work in practice. With just 3 intraoral images, the system analyzes findings in under 10 seconds, delivering results with up to 96% accuracy. This speed and consistency are critical in a busy clinical environment like in a hospital or a college. Behind this is a strong data foundation, over 1.2 million annotated images, curated and reviewed with clinical expertise. This allows the system to reliably detect 40 plus oral and dental conditions, ranging from soft tissue findings to structural indicators. What's particularly powerful here is predictive AI. Now, instead of only showing what exists today, Scano can indicate how a condition may progress over time, helping clinicians intervene earlier rather than react later. And here's a key behavioral insight: patients act on visuals, not on reports. When patients can see current findings and potential progression, decision making becomes clearer and faster. This dramatically improves understanding, trust, and treatment acceptance. So, in short, Scano combines clinical intelligence with visual communication, turning all that complex data into actionable insights for both the dentists and the patients. So, this leads us to the outcomes we are seeing in real clinical practice. One of the key strengths of Scano is that it just doesn't focus on just one aspect of dentistry. It provides a comprehensive AI coverage across multiple clinical dimensions. So first one is our tissue AI. This focuses on soft tissue analysis, helping identify potential risks and abnormalities early. Soft tissue findings are often very visual and very subjective, and AI helps bring consistency and clarity to this assessment. The second is Smile AI. Now, this supports outcome simulation, allowing patients to visualize potential treatment results even before a procedure begins. So, when patients can see those possible outcomes, confidence and acceptance improve significantly. Third is our X-ray AI. Now, this analyzes OPG radiographs, assisting clinicians in interpreting radiographic findings with greater consistency and efficiency. So together, these models ensure that AI covers hard tissues, soft tissues, and aesthetics, creating a sort of more holistic diagnostic and communication framework. This result is not just better diagnosis, but better conversations and more informed decision making between the dentist and patients. Now, let's look at what impact this has had in real clinical settings. So this is our Scano AI ecosystem for clinics, hospitals, dental colleges, and institutes. To make AI truly usable in clinics and institutes, it needs to work as an ecosystem, not as disconnected tools. That's exactly how Scano is designed. It begins with Scano Air, our AI robot. This is a screening device, which is typically the first touch point, enabling quick, consistent screening and early risk identification at the start of the patient visit. Next is the Scano Care app, which focuses on patient engagement. It helps patients visualize findings, understand their risks, and stay connected with their oral health journey beyond the dental chair. Finally, we have Scano Engage application, which is the clinic platform. This brings everything together: patient data, AI insights, follow ups, communication, helping clinics manage workflows more efficiently and consistently. I think here what is important to notice is that they are not individual products. It is the integration here that matters. All these three products work together to create a seamless AI driven workflow from screening to consultation to follow up. This is how AI becomes a part of daily practice. It's not an extra step. And when AI is integrated this way, the impact becomes measurable. Now, let me quickly show you a demonstration of Scano AI Robo. So I hope you were able to see how easy it is. Under 90 seconds, each screening is done and patient immediately receives their WhatsApp. Let me also quickly show you how our soft tissue AI works. This flags any precancerous or cancerous conditions that the patient may have. It also gives a confidence scoring. Now, let us talk about a few case studies. So, number one is corporate screening can. Let me share a real world example that highlights both the clinical and business impact of AI. Now, in this case, Scano was deployed during a corporate screening camp where over 500 employees were screened in a short span of time. So, what stood out was that 38% of these individuals had undiagnosed gum related issues, conditions that had gone unnoticed because there were no immediate symptoms. So, this reinforces that earlier point about dentistry being largely reactive rather than preventive. What happened next was equally important. So within 60 days, the participating clinics saw a 22% increase in footfall. Now, this wasn't driven by aggressive marketing and such, but it was driven by early identification, clear visual communication, and improved patient understanding. This case study demonstrates that when AI is used correctly, it delivers dual value. One is clinical value by identifying diseases earlier. Second is business value by improving patient engagement and clinic utilization. So, in short, AI doesn't just enhance diagnosis, it helps convert awareness into action. Let's look at another example. So in this case, it was a school health program. So this example actually focuses on preventive dentistry at scale. So in this initiative, over 5,000 children were screened using AI-enabled workflows. So the objective was very clear. It was not treatment on spot, but early identification of risk before patients became severe. So as a result, more than 700 children were flagged for early intervention. These were cases where timely action could prevent long-term dental issues, pain, or more complex treatments later in life. What this demonstrates is the scalability of preventive dentistry. AI enables rapid, consistent screenings across large populations, something that would be extremely difficult to achieve through manual processes alone. Beyond the clinical outcomes, programs like these also create significant social impact and goodwill. They help build awareness, trust, and long term relationships with these communities while reinforcing the role of dentistry as a preventive healthcare discipline. So, this is AI. It is not just as a tool, but as an enabler of uh, accessible preventive oral healthcare. I think as we look ahead, the future of dentistry is clearly patient centric and AI enabled. So in this model, the patient becomes a partner, not just a recipient of care. Patients are better informed, more engaged, and actively involved in their oral health decisions. AI plays a key role through education and timely reminders, helping patients understand their risks, follow preventive guidance, and stay consistent with follow-ups. This kind of shifts care from episodic visits to continuous engagement. So now we are also beginning to see the use of conversational AI, such as ChatGPT based interactions, to support patient communication, answering routine questions, reinforcing post treatment instructions. Most importantly, AI, like I said earlier, it does not replace dentists, it amplifies dentists. It enhances clinical insight, strengthens communication, and allows clinicians to focus more on care judgment and patient relationships. Now, here I'd like to briefly highlight a milestone that reinforces the credibility and trust behind our work. So, Scano was a part of the Google Founders Academy APAC and has been built with the support from Google Founders School and Google Founders Academy ecosystem. This engagement provided access to global mentorship, technical guidance, and best practices, particularly around building responsible, scalable AI, which is critical in healthcare. In a field like healthcare AI, trust and validation matter. Being associated with programs like Google Founders Academy adds an additional layer of confidence, both in the technology we build and the standards that we follow. So for us, this isn't about branding. It's about ensuring that AI in healthcare is developed with rigor, responsibility, and real world impact. And I think with that, I'll move to closing thoughts. So AI in dentistry is no longer something for the future. It is something that can be adopted today. So I want to leave you all with one very clear message. AI will not replace dentists, but dentists who use AI will lead. What we are witnessing is a fundamental shift in dentistry from being reactive, where we respond only after symptoms appear, to being predictive, where we identify risks early and intervene proactively. AI enables this shift by improving visibility, consistency, and communication, while keeping clinical judgment firmly in the hands of dentists. So, the future of dentistry is not man versus machine, it's dentists empowered by AI, delivering smarter, more preventive, and more patient centric care. Thank you all. I'd be happy to address any questions that you may have before passing the platform to Dr. Akshata.
Yeah, Dr. Ritu, we shall take up the questions in the end after finishing both the sessions so that it'll be, we'll have a compilation of the questions and later we'll take up. So it's a request for all the spectators to just text the questions in the chat box if you have any questions so that we can just take up in the end. Is it okay, Dr. Ritu, or is it fine, or you want to take up now itself?
No worries. I think after Dr.
Okay,
Akshata,
so both of you can.
Yeah.
So both of you can take up together. So we shall move ahead with the next lecture and we'll take up the questions together after having heard both the end. Okay. Yeah, thank you. We'll just move ahead. And Dr. Ritu, it was indeed a very enlightening session, and we shall continue with the other speaker, Dr. Akshata Poojary. She's a dentist, passionate about merging clinical dentistry with technology and research. And she graduated from AJ Institute of Dental Sciences in 2022, and she currently serves as the lead of the dental annotation team at ScanO, where she contributes to AI-driven dental research and model development. Her work involves hard tissue, soft tissue, and OPJ annotations, creating annotations guidelines and training annotators to ensure high quality data for machine learning applications. And Dr. Akshata is dedicated to bridging dentistry with artificial intelligence, inspiring dental professionals to explore the future of AI in oral healthcare. So over to you, Dr. Akshata Poojary, and then we shall take over with the questions in the end. And I expect the spectators and the audience to text the questions if they have any in the chat box. Thank you. Yeah, over to you, Dr. Akshata. Am I audible? Yeah.
You're on mute, Dr. Akshata. You're
You're not audible, Dr. Akshita. So, could you please unmute your mic? Yeah, Dr. Akshita, am I audible?
You're audible, doctor. Actually, Dr. Akshata is on mute.
Okay, I mean, am I audible to Dr. Akshita? Probably it's blocked.
Yes, yes,
Okay,
you are audible. Yeah.
okay. Yeah, thank you, thank you.
Able to see my screen, right?
Yeah,
Yeah.
it's visible, it's visible.
Yes. Okay. Hi, everyone. So I'm really happy to see you, so many of you here today. So today's session is about how AI is transforming dentistry, and more importantly, how dental annotation is the foundation which makes dental AI possible. Okay, so before going into the topic, so why AI in dentistry? So as Dr. Ritu explained, so mainly the managing patient load, and it also helps in detection of the early lesion, like as Dr. Ritu explained, soft tissue lesions. If patient has an initial lesions, it will detect that, and patient we can create the awareness among the patient. And also it acts as a decision support, like it act as a second opinion for a doctor. Okay, and the goal, it is not to replace clinician, it's to empower clinician with the precision and early detection. So patient care become faster, safer, and more reliable. Now, what is dental annotation? Okay, so how does AI actually learn dentistry? So as Dr. Ritu explained, so Scano Air, it gives the diagnosis at the end of the scan. So if patient has pit, if patient has caries, it will give the diagnosis. So how it is done? So for that, what we do is dental annotation. We train the AI model. Okay, so AI learns from examples and annotation at the teacher. So without high quality annotation, AI cannot learn clinical patterns accurately, and it cannot make reliable prediction. In simple word, annotation is teaching AI to think like a dentist. We label dental images so machine can learn what we recognize clinically, like caries, restoration, missing teeth, bone loss, landmark, everything. So dental annotation isn't just marking images. It's translating our clinical knowledge and experience into structured data, which powers the future of dentistry. So as a dentist, we are the connection between this patient reality as well as this AI technology. And now, what is this AI model? Okay. So think of an AI model as a digital version of our brain, which is made up of an virtual neurons, which learn pattern similar to how we learn during training. So what is this training a model? Okay, training a model means we are teaching this digital brain. We show it a large volume of images, like for example, we show caries and what is a sound tooth, and malaligned versus well-aligned teeth, and inflamed and healthy soft tissue. And we also show normal anatomy as well as abnormality. So as the model sees this example, it performs millions of calculation to detect patterns. There will be a millions of calculation, so which is done from the back end. Over a time, it learns to identify what each condition looks like dental students, how the dental students learn through repeated case exposure. Okay, and simple way to think about is, okay, AI starts like it's a newborn baby, it knows nothing. To make it useful, we must feed it with the examples, and the quality of the example and quality of labeling is what decide how accurate and dependable it becomes. That's where annotation becomes non-negotiable. Okay, and why this dental annotation is exciting? So it helps build smarter AI which can detect diseases earlier. It directly contributes to, we are contributing to real world research as well as innovation. It allows dentists to play a key role in shaping clinical AI with our knowledge, not just with technology. It's not just about a technology, it's about our knowledge. Whatever knowledge we implement, the AI implement to dental annotation, we train the AI model according to that. And also, this is the main foundation for AI training. This dental annotation is the main foundation. So dental annotation is, we get the images of this oral cavity, that is upper lower and front angle. By seeing the images, whatever diseases you can see, you have to label that diseases. So types of dental data we work with. So in Scano, what and all data we are working with, that is hard tissue, intraoral images, and we are also started with X-rays, which include IOPA, OPG, Bitewing, and CBCT. And next will be the soft tissue. And we are also working on smile design, that is before and after images. And we also started with skin and air AI. Like if patient has a pimple, like we show before and after images. So after treatment, how it looks. It's in the initial phase. It might take 3 months to launch. So our annotation tooling. So we have an inbuilt annotation platform, which is done by our tech team. So what we do is we have this polygon and bounding boxes. I will show the demo of the annotation so you will understand it better. And we have a subclass as well as superclass. So what is this annotation process? So first you will receive the images of intraoral, then either it will be soft tissue images or it will be OPG or radiograph. So next you have to identify the regions, like you have to identify the which teeth is that and whatever soft tissue lesions can be seen and what is the pathologies. Then we have an guidelines for all the three annotation, that is all the three radiograph, soft tissue as well as intraoral. According to the guidelines, you need to annotate those. Once the annotation is done, it will go for review and quality check. Once that is done, okay, this is the video of how annotation is done. So this is our annotation platform. So we have around 40 plus diseases. So you have to mark tooth also, tooth from central incisor to molar. Whichever tooth is visible, you are supposed to mark those. So this is the bounding box. So there will be starting and ending point. So starting and ending point, it should meet. Once it is done, then you can press save or enter. Then whatever diseases is seen in these images, you have to mark everything like malar tooth, inflamed gums, stains. So this is of OPG. OPG also same. First we have to mark the tooth. Then we have the findings, radiographic findings. So whatever findings you can see, you have to mark those. And you are supposed to mark landmark also. So this is for soft tissue. In soft tissue, we mark anatomy as well as the lesions. In soft tissue, for now, we have homogeneous cancerous, non-cancerous, and precancerous, as well as non-homogeneous cancerous and precancerous. So it's in a beta phase. We are working on it. Right now, it will give the probability, like as Dr. Ritu showed, like it will give 50% patient might have this, 50% patient might have this. The final diagnosis, it will be given by the doctor. And same way, you have to mark the lesion. Wherever there is lesion, you have to mark those. Now, expert role in AI annotation. So, what they do is expert. So, it's basically my role. That is, I develop guidelines, then train and guide the new annotators. And I also collaborate with the tech team and quality assurance, that is, review. And there are some challenges in dental annotation too. Like, there is a varying image quality. Like, sometimes you get the blur images, sometimes high contrast images. So in such cases, we usually skip those images, and before we are giving the images to annotators, we usually segregate images, that is good and bad images, for all the three annotation. And subjective pathology means, like, if I think the patient has stain and another dentist might think a patient has pit. So we get a different opinion also. In such cases, what we do is we have a group of dentists, we sit together and we discuss those cases and we come to the common conclusion. And also we need a extreme precision. Like if there is a stain, you are supposed to mark stain only. Like if you mark tooth also, then the model will think, yeah, tooth, it is a stain. So there must be an extreme precision. Now there are some roles and target also for this annotation. So we offer freelancing part-time and full-time, that is for annotation. Okay. So, and our training model happens every month. We do have a target that is 10,000 to 15,000 every month. Once the target is achieved, we put it for training. So every month there will be we'll see whether there is an improvement of accuracy or not. Now, career opportunities in dental AI. So right now we have four opportunity, that is product specialist role. So as a product specialist, your role to help the stakeholder adapt and effectively use the Scano ecosystem, that is doctor. You act as a bridge between clinics and the product team. By you have to onboard the doctors and clinics onto the platform, and you need to demonstrate features, workflow, and real clinic use cases. Like as Dr. Ritu mentioned, we have in Scano Air. You are supposed to give the demo of that Air and also two app, that is Scano Care and Scano Engage, to the dentist, and you need to convince them to buy our product. And also your responsibility will be collecting feedback from the clinicians and translating it into an accountable product improvement. So you need to collect the feedback from the doctors, like how it is working, what feedback they have, and then you have to tell then you have to convert it into product improvements. Okay. Then supporting adoption, so the tools is used consistently and correctly in day-to-day practice. Now, research and development. Under this, there is main role is annotation. I explained it already. And you can also contribute to writing papers and participating in scientific discussion and session. Then, then third role will be engagement specialist. So engagement specialists focus on creating real world impact and maintaining strong clinical relationship. So responsibility will be coordinating client activities and clinician engagement. The one who buys our product, you need to coordinate with them and ask their feedback. Like you have to see whether they are using our machine or not, what is their feedback, everything. Then conducting webinars, demos, and educational sessions. Then we have one more role, that is content creation. Like if you are interested in writing blogs, video, if you are interested in making videos and all, then you can opt for this role also. So if you are a dentist exploring non-traditional careers, dental AI offers multiple paths. So product adoption, research engagement, and content, where your clinical knowledge remains the core skill. So I think product specialist and engagement specialist, Dr. Ritu can explain it better because she is into that. Dr. Ritu?
Yes. So as Dr. Akshata mentioned, product specialist role and engagement specialist role would require you all to directly be in touch with the doctors. So if you are opting for a product specialist role, you will be required to speak with the doctors and explain to them how AI can add real value to their clinical workflows, and how AI powered systems like Scano are exceptional and why they should have it in their practice. As an engagement specialist, you will be required to speak with the doctors on board, partners who are already using Scano, to see if they are using the machine smoothly, if they are facing any issues, any queries that you may have. You will also be required to conduct webinars and participate in screening drives, maybe community outreach programs, and help our partners kind of drive those themselves. So these two are the roles that would require you to be on the front end and speak with the doctors on daily basis.
Yeah, product specialist and engagement specialist, this is the in-house role, and where annotation and content creation, it can be done remotely. So conclusion, the future of AI-driven dentistry. So this is not replacing dentists, it is empowering the dentistry. Okay, thank you. That's it.
Yeah. Thank you, Dr. Akshata and Dr. Ritu. Uh, any questions from the audience? I think you can type it in the chat box. We will open up the audio and the video session. Okay, there's one question.
So I have one question from Dr. Sachin. Till what
Yeah,
extent we can use the AI incorporated guided surgeries
Audio.
using guided stents and even navigating systems available these days? Initially, CBCT came followed with intraoral scanning, then merger of DICOMs and
Yeah, Doctor.
STAs.
Yeah, Dr. Ritu. We'll open up the audio for him so that at least he can convey the message to all. So that will be better. You can just convey the answer in that place. Okay. Just I know. Hmm? Not available. Okay, Dr. Sachin probably is not available because of the connection part, I think. So his question was whether before ordering for stents to lab, we should take the data to AI and see its opinion. And if the AI says or prefers freehand surgeries by an experienced dental surgeon, in that scenario, what is your take, ma'am? Is the question from him.
I was not able to understand the question here. If you can explain the question, Dr. Akshata,
No,
you
what
understood
what
the
actually what he's trying to ask is like before ordering for any stents, should we take the data to AI and see its opinion and take its opinion regarding what it says or prefers for a freehand surgeries?
I think
Or
we have not, yeah. I can only talk about Scano here. I think we have not yet trained our model on that. So once
Yes.
we, of course, once we start working on that, we will be in a better position to answer this because currently our model is trained on hard tissues and soft tissues as of now. Even soft tissues last year was released in beta, and currently we are working on radiographs. So I think till we step into that, we will be able to better answer this question if we can take AI's help in kind of guided stent surgeries. Yeah.
well, that adds to another question like, is it possible, supposing as the question goes, the decision making of AI, can it be considered rather
I
than
think
the
Dr. Akshata
knowledge?
can better answer that.
Dr. Akshita?
Sorry?
Yeah, actually, as Dr. Ritu said, like
Hmm.
supposing the scanner is not trained as yet, but suppose is that available for AI where the decision-making power is given to the AI regarding the treatment planning and all? That was the question that was asked in connection to what
Yes.
actually Dr. Ritu gave the answer.
Yeah, as Dr. Ritu mentioned, right now we don't have that, but we can work on that, I think. We need to see whether we can do it or not. Then only we can predict that.
Okay. There's
First, we
one more
need to
question.
train the model. Yeah.
Okay.
Then only we'll
Okay.
get to know.
Okay, thank you. And there's one more question. What are the ethical concerns with AI-assisted diagnosis in dentistry like this? Uh, what are the ethical grounds and what are the legal complications that the doctors would face or the manufacturer would face, supposing if there are any legal complications?
So here at Scano, we strictly follow GDPR compliant protocols. And in the reports that goes to the patient as PDF on their WhatsApp, it clearly says that this is an AI generated report. And for the confirmation of same, you will have to go and visit a clinician, a doctor first. So we definitely follow all ethical practices. And about the data here, whatever data is collected via Scano, it remains only with the dentists. There is no third party involvement, and actually the data is not even with Scano. It remains only and only with the dentists.
Yeah, one more question is from Dr. Sabiha from down south. How do we proceed in writing blocks as such? What is the target? Is the question from there. That was one of the career opportunities as mentioned.
Yes,
So
yes.
how do we proceed in
The,
writing blogs and what is the target that you expect is the question that is from one of the audiences. Dr. Sabia is to ask this question.
So I think
Doctor,
blog creation, we have an opening in that. So I don't think there's a particular target for that.
yes, there is
We
no
just
target.
we just look for great expertise and a skill oriented person. Anything creative that you can think of. So of course there are these case study developments that go hand in hand with our partners. Whoever is using Scano since a long period of time, we create short stories, videos, reels, blogs, and articles on our website, that is Scano website, on our Scano Care app as well. So if you are open to that, and if you think that that is your calling, you can definitely reach out to us.
Okay, how to apply for the same? Supposing if they want to just work for the blogs for that company, whatever actually they want to just go for it, and if they are trying for other career opportunities, non-clinical based on the dentistry, then how do they just go for applying for that job as such? Supposing if they want to just skip.
Dr. Akshata.
Yeah, they can reach out to me. Like you can give their name, so I will contact them.
Okay, then in that case, whoever the attendees here, if they are interested in any non-clinical
Yes,
part of it, we can communicate you anytime to guide them to
yes,
just
definitely.
opt for the opportunities, career opportunities that you have already just quoted right now, right?
Yes, definitely, definitely.
Dr. Akshata, you can also in the chat box, you can just write your email ID and your business number so that
Yeah.
it's easy for them.
And one more question is from Dhruvisha. She's raised in hand. So we are unmuting a mic. Dhruvisha, if you can just ask the question, we are unmuting. Is it possible? Yeah. We are unmuted. You have raised your hand. Do you have any question, Dhruvisha? Dhruvisha, are you here? You have raised your hand with the question. If you have, you can just unmute yourself. The permission is granted. Please unmute yourself. No? Okay, there's no reply from there. She's just raised her hand. Probably she's not having. You can text the question. Supposing if you're finding it difficult technically, you can text the question. The students start developing to work with these AI tools. What is the basic skills that they need so that the dental students can start developing from the initial stages, the moment they just step into the dentistry, so that they can train themselves to offer multiple career opportunities.
Dr. Akshata.
Sorry, I was not able to hear.
So my question was, the
Mm,
moment the students step into dentistry, if they want to train their minds to get the skills so that they can opt for these non-clinical part as well as an
yes.
opportunity or this side job as well. So what skills should dental students start developing to work with these AI tools so that they can have a broad career opportunities?
Yes, for product specialist and engagement role, like we mainly look for a good communication skills and good convincing power. And for annotation role, basically we look for a good dental knowledge, the main thing, and artistic work also, because we, as I said, we need to do the bounding box and all.
This is answer.
Yeah.
Answer. No? This is answer.
So I think final year students and third year students can actually participate, Dr. Akshata, and even
Yes.
interns.
Third years, final years, and interns, they can do annotation.
Okay, there's one question by Dr. Anupama. Uh, I think she
I
is
think
from down
so.
south. Um, As it's still under upgradation stage, if we install Scan O now and with the same, do we have an option of upgradation of software?
Yes, very much. Because it's an AI product, upgradations will happen. So even if you install Scano now and whatever upgradations we do in future, you will be able to have that option and you can always upgrade your software. And you will have all the new features that we would launch.
Okay. Okay. Dr. Anupama, is it hopefully it's the answer is clear? Yeah, thank you. The thank you messages come from her.
Yes.
And then one more question as such. Okay, it's a question like, will AI replace dentists or act only as a decision supporting tool in future?
Yeah,
See,
it's not going to replace.
my entire PPT was about
Because
that.
anyways, yeah, that is quite clear that they need this thing. And one more question is that during the annotation process as such, individual tooth were marked.
Hmm.
Supposing if there's a wide diagnostic area, be it any pathology for that matter, does it require just a wide area to be marked and then left for the diagnosis, or the individual tooth needs to be marked along with the
Individual
pathology that is there?
individual tooth needs to be marked along with the pathology of particular tooth. We are marking it separately, every tooth.
The pathology may not involve any of the tooth. Probably there are some findings like attrition, abrasion,
Hmm.
or any resorption as such, but the
Hmm.
pathology is reflecting in the bone and connected to the tooth. So in that case, the whole area wise, it can be marked and sent, or the tooth alone, which doesn't have any attrition, abrasion, even that can be marked and sent for the diagnostic part.
No, if tooth has attrition, then only we mark. If there is no any findings, we are not going to mark. And as you said, bone loss, we are not marking bone loss in intraoral images. That is only done for OPG. That
So
means
these
radiograph.
okay, these will be trained for those who opt for the career opportunities, like
Yes.
what is to be done and what are the guidelines that needs to be given to for the annotation process and all.
Uh, Guidelines, like if anybody is interested, then as I said, you can give their numbers to me. I will contact them. I will give the demo of how exactly it is done. Once that is done, then there is no particular like quality like students should have this or not. Anybody can opt for this.
Okay,
Yes.
then
So
how does? Oh, yeah, sure. Please go ahead.
yeah.
You were saying
So
something.
once the demo is done, then they will be given some test images. So based on that, we'll decide whether we are going to proceed with them or not.
Okay, and how does this platform handle patient data privacy and consent as such?
Dr.
Supposing if
Ritu?
there is any queries from.
Patient, so patient consent is given because patient has to anyways enter their mobile number, their name and age before starting the screening process. That is where they are giving their consent. And here, as I mentioned, we follow GDPR compliant protocols. So all the ethical and privacy concerns are taken into account. So patients are anyways giving their consent because they themselves, because this ecosystem that we have created, doctor, this is more for patients and less for dentists. Patients are able to screen themselves and they will be able to enter their name, mobile number, WhatsApp mobile number, and their age. That is when they are giving their consent. If they are not, if they don't want their mobile number or their, these private information to be shared, they need not go ahead with the screening.
So one more question is like the manpower that is required for this multiple career opportunities. It is work from home, or it like they'll have to be in that company to just guide for everything. That is another question that has been asked.
Yeah. So as I explained, the product role as well as engagement role, it is a in-office role. And for annotation, blog writing, or any paper writing, it is a remote role.
Okay, those who are interested, we can share the numbers
Yes,
as such for
definitely. Yes.
review.
Yes,
Okay,
yes, you can share. I will contact them.
fine. Okay. Any other questions from the audience? Who are looking for any non-clinical this thing career opportunities as well? And if you want to share your ideas and then move ahead. One more. Who is this, Dr. Pranay? There's a question from Dr. Pranay. What are the medico-legal implications of using AI in dental radiology?
Dr. Akshata, talk about the DPDP Act that we have
Yeah.
to take into.
Yeah, sorry?
So, doctor, there is an entire guidelines and SOP structure that we have. So before taking on board those doctors as annotators, we make sure that all the guidelines are following the DPDP Act. So that is the medical legal implications that the question here that they've asked that takes care of that, the DPDP Act. So while they are onboarding, so we train them on all the medical legal complication or the implications that they have, and we also train them on the SOP and the training processes and the guidelines that they have to follow before starting the annotation process. And we also teach them in detail about the act and what guidelines they should follow.
Yes.
Okay, any other questions from the audience? Any other questions? So, okay, the audience who are willing for any other career opportunities or anything to learn, you can just express your interest and text a message to me. Anyways, all of you have my numbers and the email ID that is already been shared. So I shall communicate with the respective people for the job opportunities as well, and they would guide you how to just move ahead to increase your, to enhance your job opportunities. And it was indeed enlightening, Dr. Akshata and Dr. Ritu, and you have already, I mean, you've been communicating really well and responding. Thank you so much. And we shall move ahead with a vote of thanks and the certificate delivery as such. So I would request our Associate Professor Dr. Juhi Anilpuri to deliver the vote of thanks and give away the certificate for both speakers.
Good afternoon, everyone. As we bring this webinar to a close, I would like to extend our heartfelt gratitude to those who made this event a success. First and foremost, our sincere thanks to the management, KJ Mehta TB Hospital Trust, for providing us with this platform. Our organizing chairperson, dean, and moderator, Dr. Pankajakshi Baike ma'am, for her expert guidance and for leading today's discussion so effectively. I also want to thank my colleagues on the organizing team, Dr. Purohit sir, Dr. Chandrasekhar, Dr. Sandeep, Dr. Ayush, and Dr. Hasti for their dedicated efforts. A special thanks to our speakers, Dr. Akshata and Dr. Ritu, for showing us the incredible potential of AI in the future of dentistry. We also appreciate Dr. Mandeep for his support and Mrs. Ankita Bissa and the entire IT cell team for the smooth technical conduction of this session. Finally, I would also like to thank all our participants for joining us today. One thing that I would take as a take home message today is AI is not going to replace me. Rather, it will make my job easier and better if I know how to use it. So, thank you to everyone. Thank you, Dr. Ritu, Dr. Akshata, and ma'am, and have a wonderful weekend. Thank you.
Thank you so much.
Thank you so
Yeah,
much.
thank you,
Thank you so
Dr.
much.
Johi. And we shall share the certificate. Please share the certificate.
I would again request all the participants to take down Dr. Akshata's email ID and drop her an email if you are interested in any of the roles that we mentioned, and she will contact you. Her email ID is there in the chat box.
Yes.
Yeah, please note down everyone. The email ID is just mentioned in the chat box. Yeah, the certificate. The certificate is for Dr. Ritu Nandal. Thank you so much for being here on this platform and enlightening all of us. And anyways, as I said, we are looking forward for a memorandum of understanding for physical training as well.
Yes.
And we would look forward, and I would definitely invite you all for the physical training and of our students and other research matter as well. We want to look forward to have an MOU with you all. So thank you so much, and another certificate.
Thank you so much, Doctor. Yes, we will share the MOU in a few days. And
Yeah.
we look forward to, the research collaboration with the institute and the continuous support that we can provide you all.
Yeah. This certificate for Dr. Akshata Poojary. Thank you so much.
Yes, thank you so much.
Okay. And anyways, as I said, we shall share the MOU between our institute and yourself for the research as well as for other things that actually the MOU would mention. Okay.
Yes,
We'll expand the collaboration between both of us.
yes,
Yeah.
definitely. Yeah.
And thank you so much, all of you, all the audience who have joined here, and for making it a success. And please take down the email ID of Dr. Akshata. Whoever wants to communicate with her, free to communicate for any other job opportunities or any other clarifications that you require. Yeah, thank you so much. I think
Thank you so
everyone
much.
can, yeah, I think the participants can exit from the platform one by one.
Thank you, Doctor. It was an amazing session, an enlightening one, and it was uh, good to be a part of this session. Thank you so
Good
much for your time.
contribution from both. Thank you
Yeah.
so much. It's a pleasure is ours and good contribution from both of you.
Thank you. Thank
Thank
you
you so
so
much.
much for giving us the opportunity. Yeah.
Okay, end meeting.